for taking some time to sit down with us today. We're thrilled to be able to have a conversation with you. I know you've been very active in studying histiocytosis, specifically HLH, and just really excited to learn a little bit more about this particular paper that we recently saw was published. Return to school practices after hematopoietic cell transplant: a survey of transplant centers in the United States. Really just excited to understand more of the importance of the study, what drove you to do this work, and any future implications. So we have a couple of questions for you. But first, before we dive in, would you mind just introducing yourself a little bit, maybe how you got interested in histiocytosis, where you're practicing, just so we can introduce you to the community?
Thank you for having me, and I'm glad this paper is of interest for the Histiocyte Society. So my name is Neel Bhatt. I'm an assistant professor of pediatrics at University of Washington in Seattle, Washington, USA, and I'm also assistant professor in clinical research division at Fred Hutchinson Cancer Research Center in Seattle as well.
Thank you so much. Can you tell us a little bit about this study that Deanna mentioned, and maybe what the significance is of the study?
Yeah, so I have been interested in understanding how patients who undergo hematopoietic stem cell transplant um, integrate back into the society. So I have been interested in how their return to school experiences are, how they go back, how the experience of returning to work have been. So we uh, also realize that there has been a lot of variation in return to school practices across all different hospitals in a initial small survey which was done very informally across few institutions. So we thought that we should formally study this, understanding the timing of returning to school for patients, also the type of support patients receive at that time of returning to school. So that is why we did this study through several different national organizations, such as uh, National Marrow Donor Program, CIBMTR, and then also the Pediatric Transplantation and Cellular Therapy Consortium, PTCTC. So all of them supported this study to survey their membership and asking various questions about the timing of return to school, the support provided by their institutions, and the factors that they are considering when kind of thinking about sending a patient back to school. So the results of the study are very relevant across the U.S. Because we got response from so many physicians from different hospitals and practicing in different settings, large or small, transplant centers, community versus academic centers. This is the findings are very significant and relevant for our patient population, and hopefully we can use the information to develop some guidance for clinicians who are taking care of these patients, and educate them about how they should be preparing patients when they go back to school.
Thank you so much. It definitely is an important topic. And I think the collaboration across so many centers and with so many different organizations is really very interesting. And it's great to see that they're eager to participate. It just shows the importance of this topic. And you touched a little bit on it, but can you elaborate more on the importance of this study? Sort of, what do you see? What inspired it? What was the big gap that, or a challenge or question that drove you to wanting to look into this more?
In my work, I have realized that patients, when they we assess their quality of life, they always respond saying that their school function is one of the most challenging aspect of their quality of life after a transplant. So we had done a study, secondary analysis of a CIBMTR paper, which showed that even at 12-month post-transplant, patients were having poor school function. And there was another paper from UK which showed that even at 5 years time point, their school function was still substantially affected. So that made me think that this issue needs to be addressed. And those studies were done, from patients' aspect. But I also wanted to know what is the role of physicians and transplant center in this process, because they are also equally important stakeholders in this, making sure that the return to school is successful for patients. Um, so that is the reason why we did the study, to understand, because there is really no guidance across the country educating physicians in terms of when they should be sending patients back to school, and also what sort of resources they should be providing patients when they go back to school, and what factors they should be considering in terms of patient's readiness, any laboratory tests, any physical or like any criteria specifically for any immune reconstitution or vaccination. So all those things, we were trying to figure out if there is any sort of uniform information that we can come up with using the survey, that we could use towards as a next step in when we are thinking about making a guideline or guidance for physicians or clinicians, in terms of returning to school post transplant.
That's fascinating. As I'm listening to you talk, I'm just wondering, as you're looking at all the data that's coming in, are you considering any of the mental, emotional aspects too, or just the physical healing part of the equation?
Yeah. So we should be looking at all of them, both, physical and mental readiness of returning to school. When we asked centers first, we asked them if they have any SOP or standardized operating procedure document that tells the clinicians when they should be sending patients back to school, and what sort of things they should be looking for at the time of returning to school. So we asked about 82 centers about their SOP, and we got a response from nearly half of them. And we obtained a few of the SOPs that were provided to us. Not all the centers had SOPs in place, but some of them did. And we looked at them and we realized that not many centers were as specifically mentioning the patient's physical or mental readiness of returning to school. They were mostly interested in what is their CD4 count, what is their vaccination status, what is their graft versus host disease status post transplant, and what sort of immune suppression they are on. But no, only once or center, if I remember, had mentioned that they do look at how patient is feeling from physical emotional standpoint, and that factors in the timing of return to school. I think sometimes we are so focused on numbers, the overall health aspect from the disease standpoint and from recovery standpoint. We sometimes forget that patients' readiness has also is also equally important, and we need to take care of that. So when we are thinking about making some guidance for the patients for the clinicians and patients as a next step, we will be definitely considering that in the guidance as well.
Amazing. Yeah, I think that that's so important. It's a wonderful question to ask, Kathy, and I love that you're considering all the different aspects of the journey for people that have this stem cell transplant. What are some of the ways, and you may have touched on certain aspects, but what are some of the ways that you can see this influencing? You talked about guidelines or potential best practices. Are there other ways that this will influence research, treatment, or other aspects of in the future? Where do you see this continuing to evolve and grow?
As you mentioned, we are trying to engage some of these societies in by developing a working group that is interested in coming up with some guidance for returning to school post transplant for transplant survivors. Um, and ASTCT, which is American Society of Transplantation and Cellular Therapy, has been interested. They actually have recently published similar guidance for patients returning to work after transplant. So publication is out there. So we are trying to take similar approach and focusing on pediatric population who are returning to school post transplant. Um, so that's one area of interest, and the next step for us. The other things that we have been thinking about is that as we notice that there is so much variation in timing of return to school post transplant, we notice that some physicians send patients back at 6 months post transplants, and some don't send them back up to 1 year or even after they come off immune suppression. So why is there so much variation, and what are the pros and cons of sending patients back to school early versus and late? So we need to study that, and we have been thinking about doing some sort of case control study where we compare patients going at one center for example, at 6 months post transplant versus the other center at 12 months post transplant, and see what are the differences in this population in terms of their immune, in terms of their infections, his risk post transplant, and also at the same time their quality of life post transplant. Whether I hypothesize that if they are going back to school early post transplant, they have a better quality of life. So this type of study will help us decide when do we take that sort of risk by sending patients back to school early, but at the same time knowing that that might help with their quality of life. So we need to make that sort of individualized approach for some of those patients, and not just standardize as a center, saying that no, everybody has to wait until 12 months post transplant. Some patients may benefit from going early if they don't have that many risks of getting infected, and if that's going to help their quality of life, it might be worth it.
I think those are all the questions I have for now. I really am eager to continue to follow your work and to see where else this goes. A lot of what you described, I think, is really meaningful to have those best practices for providers to lean on and for the families to know about. It really makes them feel empowered too to ask for what they need. And I love that you mentioned the individualized approach. I think that's really very important because no two journeys are the same. And so being able to have some information and data on what the generalized view is, but then how to tailor that based on your particular circumstances is amazing. So I'm just really grateful that you're working on this.
I just echo everything you just said, that this is really exciting to watch and to follow. And I can't wait to see where this goes and what comes out of this study. Thank you so much for sharing all of this with us.
Yeah, thank you. And we look forward to whenever the resources are available and being able to help to share those with the histiocytosis community. And those are going to be incredibly helpful. You have such a great, well rounded approach. Thank you so much for the work that you're doing and for the meaningful impact you're making.
Yeah, we'll be happy to help in any way possible. Thank you so much for having me again.